Michelle Whitehead, a woman from England, died after drinking large amounts of water. The 45-year-old suffered from brain swelling and went into a coma. Before she died, Michelle was receiving a treatment for her mental disorders. However, this condition developed into a habit of drinking excessive water, leading to her death. An investigation by the United Kingdom's National Health Service, or NHS, found that Michelle died from psychogenic polydipsia, a condition where patients with mental disorders consume excessive amounts of water because they continue to feel thirsty. The NHS concluded that Michelle died of acute dehydration after drinking too much water. This condition causes sodium levels in her body to be so low until she experienced brain swelling.
Hi everyone, welcome back to the C Morning Show. So we just saw a very unique story about someone that was quite interesting for us to discuss, obviously, but it's some cases that we rarely hear of. We do know that drinking water and mineral water is quite important to our body. We're actually advised to drink water regularly on a daily basis, but as you can see, as it turns out, consuming too much water over too long of a period of time can affect our body negatively as well.
Yes, years of too much of drinking water. So drinking excessive amount of water and feeling thirsty afterwards may pose risk of psychogenic polydipsia. This is a very interesting condition. And not only that this is a physical condition, but it has something to do with a mental condition as well. So what is the connection between the two? That is why today we have psychiatrist Dr. Zulvia Oktanida to discuss and get to know this condition. Good morning, doctor.
Good morning. Thanks for being here.
Thank you. So what is this condition, psychogenic polydipsia?
Yeah, well, psychogenic polydipsia is a condition characterized with excessive thirst, abnormal thirst, followed by excessive drinking or water intake.
What is excessive thirst, doctor?
So the feeling of thirsty all the time. So the person cannot control himself.
Not quench your thirst, I guess.
Yeah, to take water. So just like thirsty all the time.
Wow, how many percent of Indonesians experience this condition?
This condition is quite common among psychiatric patients.
Right.
So it's around 5 to 20% among psychiatric patients.
Right.
So what are some of the causes? I mean, we do know the name itself is already psychogenic, but what are some of the causes for this condition?
Yeah, it's quite common in schizophrenic patients. Yeah, patients with schizophrenia.
What is
anxiety.
schizophrenia?
Schizophrenia is a severe mental health condition where a person experiences delusion and hallucination.
Wow.
Yeah.
Okay, so then that connects to my next question. Are they actually experiencing a lack, like a thirst in their throat, or is it just their mind playing tricks on them?
Actually feeling the thirst.
Really?
Yeah, and usually they experience dry mouth as well.
Right.
Yeah.
It's interesting that how a mental condition can actually affect you physically
Yeah.
as well. Like,
Yeah. So it's not just like delusion or false belief that they are thirsty, but they really feel the thirst. Yeah.
All right, so...
It's a bit confusing, isn't it?
Yeah.
Yeah, I mean, so it's genetic or what kind of condition is this?
Yeah, so actually it might be due to several factors. For mental health condition, it might be because of genetic factor, and then also psychological factors, yeah, and also social factors.
Social factors in what way?
In life stressors.
Life stressors.
Yeah, life stressors, yeah. So these factors combined in one person, and it might induce mental health condition.
That might cause this condition, psychogenic polydipsia.
Yeah.
So what is the difference between this condition, psychogenic polydipsia, or just thirst or dehydration?
Dehydration, I guess, would be the one that's closest.
Yeah.
So dehydration is a condition where our body has low level of fluid.
Yes.
It might be because of excessive sweating, diarrhea, or bleeding. So it's due to biological factors. So dehydration is like a real condition where a person needs to take water, to take fluid, to make it balance. But psychogenic polydipsia, there's no dehydration.
Your body water levels are
The
fine.
level of fluid is fine, is normal, but you have this drive to take water because you feel like thirsty all the time.
Okay, so your body's being tricked to thinking it is dehydrated, and then you keep adding more water when you don't really need it.
That's pretty scary, right? I
Yeah.
mean, when, like for example, the lady who already passed away in England, when we drink too much water, what does it do to our body exactly? I mean, what's happening in our body when we drink too much water?
Yeah, there's this condition called water intoxication. Okay, so when a person takes water or drink excessive water, the body experiences hyponatremia or low level of sodium level in the body. So there's too much fluid in the body, and it might induce symptoms like headache, nausea, vomiting, muscle twitching, and even seizures or coma and death.
Yeah.
So I guess you're over diluting the sodium in your body, right?
That's true.
So let's set this record straight because I've heard many different numbers when it comes to this. What is and I don't think there's a specific number, but what is a normal or safe range of water? And we're talking regular water because I have a two-part question here. What is the safe and regular range of water that one can intake per day on a regular basis? Because as in the case of this woman, this did take place over years, right?
Yeah. So the normal range is around 2 liters per day
Okay.
for a person to take water.
Up to? Like, what can that range go up to? Because I assume
The
you can
limit.
get more.
Yeah.
Is there a top limit there?
Well, it depends on the activity of that person.
I see.
Right.
So if that person like works out a lot and then does activities which has excessive sweating, or it might be needed more than 2 liters.
Now, my second part is there's been a lot of discussion in regards to what counts as actual water. Obviously, clear mineral water, or in some countries, tap water is what you call water. But
Energy
I know that
drinks?
coffee doesn't count because you're right. Because coffee actually does make you more hydrated, dehydrated. What about things like when you mix things? For example, I have a protein shake. That's water. It's diluting the powder in it.
Or also sometimes, like in the U.S.
Yes.
When I was there last spring, it seems that there are sort of like flavored
waters.
Flavored waters.
It's a big thing there right now. Sparkling flavored water. Right.
It's like, is that also
Part of the quota? I'm going to miscalculate here.
exactly?
So yeah, our body actually needs like water, like mineral water, regular water actually.
Okay.
So well, the other type of water doesn't really count. Actually.
Okay, it doesn't count, but does that push us over the limit? Like, what if she's having like 3 bottles of flavored waters, 2 coffees, and then 2.5 liters of water? Is that going to
juice, fruit juice.
Yeah.
Well, that's absolutely gonna push the limit.
Okay, so it does count towards the limit.
It does.
It's not, you still need your regular water. There you go, guys.
I mean, it's like
Glad
the
we got that
innovation
straight.
nowadays. Is it treatable, this condition?
Yeah, it's treatable.
Oh, how?
Yeah. So the treatment includes medication. So there are types of medication that can also lower the habit of drinking. And then we also need some management of like fluid restriction. So that person might need to have like a behavioral therapy to limit himself from taking water.
Because of habit, right? Okay.
Yeah, because of habit.
Is there a psychological treatment for this as well? Because it is a psychological condition. Is there some sort of psychological treatment that one
Is it using cognitive behavioral therapy? Like, do you really need to have water right now? Like having that conversation with yourself.
Yeah. There's this type of therapy called cognitive behavioral therapy to change the cognitive error of the person. And then also to change the behavior. Sometimes you can give like a reward to that person. If you can,
Such as?
Water, not water. I'm just kidding.
More water.
Yeah.
So it really depends. Yeah,
Right.
it depends on the therapy and the therapist and the patient
Right.
to decide what type of reward is
That they want.
suitable for that person.
Okay.
Have you had patients that had,
Psychogenic polydipsia, yes, yes.
And what sort of therapy did you use at that time, especially with the reward system? I'm just curious, like
Yeah,
how.
me too.
Yeah. There's this technique that we can use. It's called token economy. So that person gets like a point whenever he can limit the water intake only maximum 2 liters per day.
Yeah.
So he gets like 1 point, and if that person can collect until like 10 points, he can get like a voucher for like shopping like in a
That I
mini
like.
market, something
That's
like that.
Right?
I like it.
Very
I can
motivating.
relate.
I love my vouchers. Okay, my sister at one point, this was years ago, she mentioned to me like the men in our family tend to have this kind of like, we pass along illnesses throughout but the women's side, they're all fine. So she said, you know, we have diabetes on the family on the men's side. One of the signs, because she said, I notice you drink water like a lot, especially in the middle of the night, you'll get up and just drink water. She's like, why? Well, I feel thirsty. She's like, you know, that's one of the onset signs like pre-diabetes or early onset signs of diabetes. So can you explain to us how that relates as well? Is any of this related? Can somebody just feel thirsty all the time and think one thing, but in fact it's an onset sign of diabetes? How is it all connected?
Yeah, some of the symptoms of diabetes are polydipsia or drinking a lot, and also polyuria or urinating a lot, especially at night.
That's me. Oh, no, that's
At night, yeah, you get up like
just
2-3
once.
times.
Right, yeah, and then extreme fatigue, your body feels like weakness,
Not
and
really.
unexplained weight loss. That's also like some of the symptoms that a person might have diabetes. But of course, we need to take several examinations.
Right, so I guess polydipsia would just be one of the symptoms of
symptoms.
possible diabetes.
Yeah.
Interesting,
Yeah.
good to know.
Are there any complications from polydipsia, doctor?
Yeah, definitely, because if a person takes water excessively to the body, it will create the hyponatremia condition.
Yes.
Yeah, while
Can we balance it out with our salt intake or no? Still not.
well,
Because that can retain water, right? Salt
Yes.
retains
Yeah,
water.
sodium.
yeah. Well, in treatment, we use this pill or medicine that has natrium or salt. Yeah,
Okay.
to treat that.
Right, right.
That's that.
Yeah.
It's-
So
it's-
complication is quite fatal. For example, like death if it's not treated very well. Yeah.
It's not very common, is it? Because I've only heard of, I don't know about you, but I've only heard of this happening
Today.
to this lady. But I've heard that there's such a thing as like, you're physically actually drowning yourself slowly over time if you have this condition, polydipsia. But
Oh,
I've never
that's
actually
scary.
heard of it until this bit of news. So when it comes to its rarity, because it's not a condition that we all hear of all the time, there's not much awareness about it as well. How rare is it actually?
Well, in terms of fatality, it's quite rare.
Okay.
Yeah. But for the people suffering from psychogenic polydipsia is around like 5 to 20% among psychiatric patients.
Among psychiatric patients.
Among
okay.
psychiatric patients. So it's even more rare among the general population.
Right. Gotcha.
Yeah.
Wow. All right, well, there you go. We've just learned something new today. It is called psychogenic polydipsia. In layman terms, do not drink water too much. Do not exceed 3 liters, you said?
Yeah.
Doctor? 3 liters.
And I
per
guess
day.
this would be a sign if somebody is maybe a little concerned. Some of the signs to look out for it.
Right.
They find themselves just thirsty all the time. They should see, I guess, a psychiatrist.
Psychiatrist,
The best
yes.
way.
Yeah.
Cool.
to know.
Thank you so much.
Thank you, Doc.
Thank you very much.
Very enlightening stuff.
It is. It is. Now let's take a break. We have more updates from around the world when we come back on the C Morning Show. Thanks a lot, Doc.
Thank you so
Doc.
much.